we are going to be talking about Medicare. I am here with Regina. She is expert. So yeah, we are going to be talking all about Medicare. Any questions you have, you can definitely ask them. Okay, so I'm going to let Regina get going, and she's going to tell us all about Medicare.
Hey, hello everyone. My name is Regina, and I am a licensed health insurance agent here in the Carrollton area. And today we're going to talk about the basics of Medicare. We're going to first start out about when you can enroll. That's a big question for everybody. Everybody knows that when you turn 65 is when you're eligible for Medicare. You do also get enrolled automatically into Part A, which you have earned and worked for, and there's no premium for that. And then you have to enroll into Part B, which there is a premium of $148.34 for this year. Sometimes that goes up every once in a while, every couple of years. So you are going to want to go on to Medicare.gov or SSA.gov to enroll into your Medicare. Or you can, of course, call the Social Security office or go see the Social Security office. There's multiple ways. However, for anyone who is retired early and collecting their Social Security payments or on disability for at least 24 months, you will be automatically enrolled into Part A and Part B and assigned a Medicare member ID number. So that is how we enroll, and those are the only people that can enroll unless, of course, you have ESRD, which is end-stage renal disease, or Lou Gehrig's disease, some couple of diseases, okay? Now, Medicare has a couple of parts, and that's where it all gets confusing, and that's what I do for you, is put all those parts together. So your first part is Part A. Part A is your hospital, your skilled nursing, your hospice, psychiatric hospital, and home health. The biggest one for most of us is the hospital. With Part A, if you go to the hospital and you are admitted, you are responsible for a deductible of $1,484, and that is for the first 60 days, day 1 through 60. You will be responsible for that amount. If you are discharged from the hospital and you return back 61 days from the first day of admittance, you are charged that deductible again. This can get kind of costly because you can actually get that 4 or 5 times depending on if anything goes wrong or depending on what happens or circumstances or your health. Most people do not spend more than 60 days in the hospital. However, if you do spend more than 60 days, you are billed a per day rate through Part A. And days 61 through 90 is $371 per day. If you go past that, 91 through 150 days is $742 per day. And then after 150 days, you pay 100% of all the cost. So that's pretty up there. That can get pretty expensive. And then it covers the first 3 pints of your blood. Okay. Now, skilled nursing, that's if you had to go to any type of facility like a rehab after a stroke, or you fall and hurt your hip, those types of places. And days 1 through 20 is $0 cost to you. After day 20, 21 through 100 is $185.50 per day. That's okay because the average stay in a skilled nursing is 14 days. So most people do not incur those per day rates. All right. Now, you must be hospitalized for at least 3 days to be admitted into and approved to be paid for your skilled nursing facility through Original Medicare Part A. And this also comes, of course, it's going to cover your hospice, psychiatric health, inpatient psychiatric health, and home health. The one thing you want to keep in mind, though, is that there is no maximum out of pocket. There's no cap, no limit. So this can get kind of costly depending, again, on your circumstance. Now, Part B, that is everything outside of the hospital. That is your primary care doctor, your specialist, x-rays, lab work, physician fees, anything that doesn't happen inside the hospital. And with Part B, that is going to be 20% of the cost to you. So you would pay 20% of all the cost. But before that happens, you have a deductible of $203 for the first medical expenses that you have to meet. So you would be responsible for paying the first $203 of medical costs in Part B. Also, there is a premium attached to Part B, which is $148.50 this year. Some people opt out of Part B because they don't want to pay that $148. This is not a very wise decision for most cases if you don't have other coverage, because without Part B, you have no medical insurance to cover things like your primary care doctor, an urgent care visit, emergency room, tests like MRIs, unless it's done inside the hospital when you're admitted into the hospital. So if you are not admitted into the hospital and you have any medical issues without Part B, you're going to pay 100% of the cost. That can get kind of costly in itself. However, with Part B, again, you'll pay a $3 deductible, and then Medicare pays 80% and you pay 20%. They do not offer any additional benefits such as vision, dental, hearing. Anything extra is just your hospital and your services such as physician, ambulance, physical therapy, preventative care, those types of things, okay, with Part B. So in essence, what this is going to cost you to have Medicare Part A and Part B is $148.50 per month for your Medicare Part B premium, the first $203 of your medical expenses, and then 20% of all the cost. If you do elect or opt out of Part B, please be aware that there is a penalty when you go back and opt back in it. The penalty is kind of steep. It is 10% for every year that you were opted out of. So for example, if you declined Part B and you didn't get it for 5 years and then you decided you needed it, you're going to get a 50% penalty, which you will pay for the rest of the time. That is unless you have creditable coverage. Creditable coverage is things like a spouse's employer, so group insurance, Obamacare or marketplace insurance, those types of insurances. It can be federal, from a job. That is creditable coverage. Having a emergency or what they call a catastrophic plan or a health sharing plan, those are not creditable coverages. So please be very careful when you opt out of Part B. Then the options of that, you need to have a Part D. Part D is your prescription drug plans. Now, Medicare Part A and B do not cover Part D. Part D is offered by private insurance companies that have contracts with Medicare to provide prescriptions for their beneficiaries. This does have a premium, which ranges from about $17 to $49, $50, $100, just depends on the plan that you choose and the carrier and the service area. They also can come with deductibles. Some have $0 deductibles, but it can go up to $415 for your deductible per year for prescription drugs. A lot of plans do limit these to tiers 3, 4, and 5, or 4 and 5, which are your specialty and brand medications. Now, the way that they determine this is that they have levels of tiers. There's a tier 1 through 5 or 6. Tier 1 and 2 are generics. Tier 3 are your preferred brand. Tier 4 are your non-preferred brand. And Tier 5 and 6 are your specialty medications. And these costs are based on each one. Each plan does have a formulary. The formularies do not have to be the same from carrier to carrier. They can vary. However, they do have to structure it in a certain way where they have to cover each category of illness or diagnosis with at least 2 medications. So you can find a plan that will cover your medication. It just depends on which tier they classify it in. Some of us may have medications that are very expensive that the formulary is not on at all. That is something that you can get with your doctor, who will get with the insurance company and file what they call an exception, formulary exception. And that is where the doctor shows medical reason that you need to have this medication, and the plan will cover it, but normally at the highest rate, so normally at tier like 4. Okay? Now, you can opt out of Part D. Some people do because they think, I don't have any medications, I don't take any, I don't want to pay an extra premium, so I'm not going to get it. That is totally voluntary in your choice. However, please be aware again that if you do opt out of Part D, later on down the road when you need it, you're going to be penalized once again. The penalty for Part D is 1% of the national premium times however many months that you did not have it. So for example, if you did not have it for 2 years, that's 24 months times the 1% of the national premium, which varies from year to year depending on when you got in it. Okay, and that is something that you pay directly to Medicare and for the rest of your life. It never goes away. So opting out of Part D, again, unless you have creditable coverage, for example, a group health plan, if you have VA, or any other type of prescription drug plan like the marketplace plans that covers, that is creditable coverage. Creditable coverage in the eyes of Medicare is a plan that is as good as, at least or better than what Medicare provides. Okay, so that is your breakdown of the basics of Medicare's Part A, B, and then the prescription drugs. There are a couple of ways that you can offset these costs and lower them by opting into plans that private insurance companies have contracted with Medicare to provide for their beneficiaries. These are the plans that some of you hear that are called Medicare Supplement or Medigap. These are the ones that you may have heard some of your friends say, I don't pay anything when I go to the doctor. This type of plan is not a Medicare plan. It is not endorsed by Medicare. It is not overseen by Medicare. It is strictly a plan that covers the 20% of what Medicare does not cover. And in order to have that plan, you will have to get with the insurance company. You will be rated. If you're brand new to Medicare, turning 65, it's guaranteed issue, so that's the best time to get in and the lowest rate. However, they do go up based on year and age. So you may get in when you're 65, paying about $115 or something, depends on the plan, the service area, etc. And then later down the line, they always go up about 2 to 8% every 2 to 5 years. These plans pay the 20% of what Medicare doesn't, so you don't pay anything to your doctor visit. However, you pay the premium every single month, regardless if you use it or not. And you also have to have a prescription drug plan because it does not include prescription drugs. Now, there's another type of plan that we are used to hearing and have seen on TV everywhere lately, which is called a Part C, which we also know as called a Medicare Advantage. Those are the plans that you see on TV that say they're $0 premium. And these are also private insurance companies that have contracted with Medicare to offer the beneficiaries the plans and cover them. You are going to get set co-payments or co-insurance. There is a maximum out of pocket, and it includes the prescription drug coverage with the plan. And these plans, because they are offered by private insurance companies, are able to offer you additional services like vision and dental and transportation. These types of plans are good. They have two types, a PPO and an HMO. An HMO is, we know, a health managed organization, which means you have a network and you have to stay within that network and you have to have a referral to your specialist. A PPO is a preferred provider organization, and what some people don't realize is that there is still a network of doctors that are considered the preferred providers. And if you go to those preferred providers, then you will pay the lower cost share. However, if you choose to go to outside doctors that are not preferred providers but do accept Medicare and take that plan, then you will be billed the higher co-insurance or co-payment for going to outside doctors, but you do have that option. Those are usually really good for people who do a lot of traveling or live in one state for some months and another state for another month. However, they are both very good plans and cover you. The level of care is equal. There's no difference as far as being treatment or diagnosed or the doctors. The same doctor takes the HMO, may take the PPO as well. So that is our breakdown right now of Medicare.
Okay, cool. So yeah, if you guys have questions, please comment them. So I guess my questions are just going to be, if you're coming up to 65, and it's overwhelming. Like, what's a good first step?
So the first step, when you guys start to turn 65, you are going to realize that your mailbox is overflowing.
Oh my goodness.
With information or postcards or booklets from every single insurance company that exists in your service area.
Wow.
Yes, because they are aware that you're turning 65. You're also going to get a book that's called Medicare and You will get this actually every single year. And this is going to go more in detail, but it's still very confusing when you look at it by yourself if you've never read it before or seen it or know anything. So yes, a good idea to sort through the big huge puzzle is to get with someone like myself, which you're more than welcome to call me, and Allison will have all my information. Mm-hmm. And we can sit down and go actually step by step and answer every question you have. Because you're going to get phone calls, you're going to get letters, you're going to get emails. You are just going to be overwhelmed with people trying to get you to enroll into their plan. And it's a very hard decision to do because you have everything everywhere and it's hard to sort through because you have so much and so many questions. So when you first turn 65, yes, you do want to contact myself, or if I'm not in your area, someone that is an agent to help you go through this, because each person may have a different circumstance. Everybody's not exactly the same. Each circumstance, each need. There is also things out there that people don't know about, like it's called extra help, which will help lower the cost of medications for those with a certain level of income. They may have questions about Medicaid or other programs that are out there. There are plans that have insulin savings benefits for people that have diabetics, or there are chronic plans that are people that have like heart failure or diabetics or OCPD, those types of things. So it is a good idea. If you have local events in your area, attend them, call me, call an agent in your area if you can find one. If you're not in my service area, I can maybe try to find you one, point you in the right direction. But if you are here in Dallas area, anywhere in the Dallas Metroplex, then I can help you and I will be more than happy to come to you. I will come here if you come here. Allison will have all of my information.
Yes. Yeah. We're making a plan. We're looking at a calendar. We are looking at scheduling some times for Regina to actually be here at ShoreCure. So if you guys want to come and meet with her, you can do that. You know, maybe we'll have it in the middle of physical therapy. So that would be perfect, right? I'm going to have all of Regina's information. Phone number is 214-518-0398. But I'm going to have business cards here at the office, flyers. We've got all her stuff. So we will definitely get you hooked up with her for sure. Awesome. All right. Thank you so much, Regina, for joining us.
Thank you guys for attending. Please don't hesitate to contact me with any questions. There's no obligation to anything. I can help you walk through this. I can help you get set up. I can just answer questions if that's what you want. So please don't hesitate, because it is a truly maze of information.
It is a maze. That's how I would describe it as well. A maze. Yes. Okay, guys. Well, I appreciate you joining us. Bye.
Bye.